Greetings, Eric Bakker. Thanks for coming back. There's a lady who's been asking questions on my YouTube channel now for some time. Just small questions here or there, so I just thought I'd do a reply to this one. This lady's named K.W. She looks like she has a vaginal yeast infection. What proportions of water to tea tree oil for douching, please? Will this establish the correct vaginal pH? And my reply was try boric acid powder in size 00 capsules. Please view my videos on this topic, Miss K.W. I'm sure I've made some. And her reply was, indeed I have, thank you, for 30 days you recommended. So each patient gets a different recommendation depending on the species, the count, lots of different things that we check out if we're going to treat a patient with vaginal infection. So the thing is, boric acid does work, but it's best used in cycles, not just in like one 30-day push and then you stop. All right. Now, if you still have your cycle, your menstrual cycle, the best time to treat usually is from about a week before the period starts. So from about ovulation through. But the golden rule is the treatment's quite specific to your particular condition. So if you notice irritation at particular times of the month, think carefully when that irritation occurs and treat prior to the irritation. If you've got the irritation constantly 24/7, then you're probably best treating from the end of your cycle, okay, right through to the beginning of your cycle, all right? And you can do this most nights. You can insert anywhere between 1 to 3 or even 5 capsules if you want. Leave them in there. Give it a good clean out in the morning. Use a turkey baster, for example, with a soft silicone flexible tip and just wash that whole area out. Irrigate it properly. Calendula tincture is quite good. I'll write that down for you. Let me just write that down. You've probably heard of this herb called calendula. Okay, so calendula, you can purchase that in small bottles from a herbalist. Try and get a low alcohol one, around 10% alcohol, 15%, 20% alcohol. A tincture made from calendula flowers, leaves and flowers. That works very nice in a small basin. If you take that up with the baster and irrigate using that liquid, it works beautifully on regenerating that whole area. Calendula is antifungal, antibacterial, and it helps to regenerate skin tissue quite nicely that's tender and sore. And it's been used in that area for a long, long time. The other one you could use is hypericum or St. John's wort. That's more for pain if you're experiencing vulvic pain. But the calendula will do a good antifungal and a healing job for that tissue after you've used the boric acid. So don't be afraid to use the boric acid for several days in a row, right? And what you want to do is each month come back and treat again, come back and treat again, come back and treat again. Even if the condition's clear, you want to keep treating for 1, 2, or 3 months additionally. Now, make sure your boyfriend is also checked out and treated. Use some tea tree oil. So check out my other video I made previously, should my partner be treated as well if I have a yeast problem? And the answer is yes. So if you're in a relationship, make sure that your partner's treated at the same time, otherwise they'll be disappointed. So I hope that answers your question, Miss K.W. Thank you.